Good evening, everybody. Welcome again to the Converge Media Coronavirus Update Show. My name is Omari Salisbury. I'm joined by
Nikki, Barron.
Producer Nikki Barron. Man, a big historic day here when we talk about coronavirus on all kinds of different levels. The vaccine is out. We saw the very first person get a jab there in the arm out in New York. I guess shots start here in the state of Washington tomorrow. All that being said, though, I'll turn it over to you. What do you have for us today, Nikki?
Yeah, those are. It's great to see that these are rolling out. It gives us a light at the end of the tunnel. So everybody, stay strong, stay vigilant, wear your masks, wash your hands, don't gather in groups. And here are today's numbers. So our confirmed cases, if you watched the morning update show, you heard about our confirmed cases since Friday. Well, they've updated it again. So our confirmed cases have risen by 1,734 cases, bringing us to a total of 203,797. Hospitalizations rose by 124, bringing us to a total of hospitalizations since the pandemic started of 12,649. We lost an additional 40 Washingtonians, bringing our death rate up to 2,918. And yeah, things are, I think we're finally starting to see the results of people gathering at Thanksgiving. But here is our COVID readiness numbers, which I think are really important numbers for us to take a look at and keep an eye on. It was nice to see that we were able to bring our percent of adult staffed acute care beds occupied by patients, meaning how many of our ICU beds are full, down under our 80% goal. So we are at 79.6. So we are barely there, but we are hitting our goal when it comes to our ICU beds. And if we want to keep that goal under control, I'm going to bring up another number here, which is our gathering risk numbers. So if you, this really great tool, which you can find at whereweconverge.com/COVID-19 resources, you're going to see there's a tool here that will allow you to put in the size of your gathering. Our current ascertainment bias is 10. So basically what that means is for every one positive case that we get, there's actually 10 out there that we don't know about that haven't been tested for. So in King County, if you gather with a group as small, or about the size of 10 people, there's a 28% chance that somebody in that group has an active case of COVID. So those are today's numbers.
Well, hospitalizations are down.
Yeah, that's a really good sign. I was just reading in the Seattle Times today that hospitals are preparing for an additional surge. And yeah, our healthcare workers are exhausted and just, they're tired of seeing it. You know, they're tired of treating these patients, you know, who have these severe cases. They're tired of seeing all the death and destruction, and they're just flat out tired.
So what's the scoop on the vaccine here in the state of Washington?
Yeah, so we had a little over 400,000 vaccines delivered to Washington State in our first batch, and we will get weekly batches going forward that are going to be probably around that size, kind of ranging. But it starts with our healthcare frontline workers. Then we're going to be moving into people who work in elder care and elder facilities, as well as the elderly. And then after that, there's not a completely clear plan as to who gets it next, but that's going to take at least, 4 to 6 months. Our experts are predicting that it will be excruciatingly slow when it comes to getting vaccinated, that for most people, we're not really going to get it, especially in Washington State. We're not going to get it until, end of spring, early summer for the average person.
And what are you gauging? I mean, just personally, I don't know if there's really any research on it. What are you gauging as far as the demand for a vaccine? And maybe does that just your thoughts? Is it going to vary by areas of the state? Or somewhere in Seattle, people might want the vaccine. Some of these other counties that might not.
Oh, absolutely. Yeah, I think that it really varies by demographic. Something that we've seen historically is there's a mistrust from the Black community around vaccination. So I think we're going to see lower vaccination rates in that community for very good reason. And there's going to have to be a lot of effort put into getting those communities to trust the government again when it comes to these types of things. I also think that there's a lot of groups that are actually not allowed to get vaccines yet. They were not cleared. So that would be anybody under 16 years of age, anybody who is pre or postnatal, still breastfeeding. So pregnant women and women who are still breastfeeding are not clear to get this vaccine. This has not been tested on them, as well as people with known severe allergies. So if you've ever had an allergic reaction to a medication, you shouldn't get they're advising that you not get this vaccine, as well as people who have certain, what was I thinking of? I lost my train of thought. But yeah, so there's still quite a few groups that just flat out can't get it until more testing is done. There's people who just won't get it because there's just not the trust there. But I know for me personally, as somebody who has asthma, it's really it's a light at the end of the tunnel for me to think that I may not get a severe case of COVID if I'm able to get the vaccine.
Yeah, I think that we're gonna have to see. They've definitely put a lot of effort into getting this vaccine out. The last 24 hours has been one of the biggest logistics mobilizations our country has seen in years. We talked about earlier FedEx delivering to the western part of the United States and UPS to the eastern part of the United States. So many people involved along the supply chain, and ultimately, it'll be interesting to see if there's a demand to meet the supply that's coming out there. And
it's pretty frustrating for me to see that it's state by state, and in some places even county by county, that we're having to come up with plans for distribution, that we don't have a federal rollout plan. It's been really wonderful to see that people who work in vaccinations, who work in these types of logistic types of positions for state and county governments, are actually coming together to figure out what they're going to do, which is not being led by a federal response on how to actually roll this out. So we're going to see I predict a very clunky rollout of vaccinations because we don't have a federal plan. There is no centralized plan for this.
I think what it's going to end up coming to is there's just going to be all kinds of caveats that you can't do this unless you're vaccinated, or you can't do that. And really, that's going to be the government mandate or rollout. You can't enroll your child in school, or you can't fly, or you can't work in this company or another, which presents a whole nother set of issues, and maybe issues for another show. I know you did an interview earlier in the day. Tell us about it.
Yeah, so I was able to catch up with Dr. Strauss at Neighborcare about mental health and the coronavirus. So not just talking about if you get the coronavirus, which we're seeing really high rates of depression and anxiety with people who are currently dealing with the coronavirus, as well as people who have healed from their initial diagnosis of coronavirus, but maybe have long-term effects. But also people who are, at home waiting for this pandemic to pass, and kind of the mental health issues that people are dealing with, and as well as some tips on ways we can stay mentally healthy.
All right, let's check that interview out now.
Welcome to the show, Dr. Ashley Strauss.
Thanks for having me. I'm excited to be here. I am a licensed clinical psychologist and behavioral health consultant for Neighborcare Health. We have several primary care clinics throughout the Seattle area. I work at our Columbia City location.
So today we're talking about the pandemic and mental health. So other than actually getting sick from the virus, what kind of crisis has this pandemic caused?
Yeah, unfortunately, there's been a huge crisis around the pandemic outside of physical wellness. So lots of people are experiencing emotional and mental distress, social isolation, economic stress, housing stress. So there's really a lot going on outside of the risk of just getting sick.
And so what emotions will people maybe feel around these issues that you just described?
There are lots of different emotions that people might be feeling at this point in time. Many people are struggling with stress, sadness, anxiety, panic, fear. I mentioned social isolation. Some people have the opposite problem, which is that they're not getting any time alone because they're stuck home with family and loved ones. And as much as we might love our family, we can have too much of a good thing. And for some people, family is not always a safe place. We're running out of safe places for people to go.
So, what kind of support can somebody seek if they're struggling with some of these issues that you've just described?
I think it's really important that people know that there is help out there, and it's important to seek help, whether that's through your medical provider who can help guide you to the right person, or talking to a behavioral health consultant like me, or some other mental health professional in the area. It's important that we have an opportunity to talk about how we're feeling, but also learn strategies and techniques for coping with those big emotions and getting through this really difficult time.
So, could you describe what one of those techniques or skills that you're talking about could be?
Yeah, absolutely. I think that there's a lot of uncertainty, and that is happening right now in terms of what the future might hold, when the hospitality or service industry is going to return, and that uncertainty can lead to a lot of discomfort and a lot of anxiety. So one of the things that we can do is we try and focus in on the things that we do have control over. And although these little day-to-day things may seem like they pale in comparison to the size of the pandemic, focusing on those little day-to-day things that we can control can give us a lot of sense of comfort and relief. So things like having a routine, waking up and going to bed about the same time, making sure that we're getting outside and getting fresh air and moving our body, making sure that we're connecting with friends and loved ones to provide us that social comfort, keeping our house clean and going grocery shopping, really sticking to the day-to-day things that we need to take care of ourselves and our families, and really help us feel like we have a sense of control over what's going on.
Those are great tips. So what resources are out there for people to find help?
Yeah. So one thing that Neighborcare Health does is we believe so strongly in the importance of mental health is that we have integrated people like myself into the primary care clinics. So you can go to your primary care doctor, and several other organizations in the area have similar structures, but you can go to your primary care doctor at Neighborcare, for instance, and you can ask or you can schedule an appointment with a behavioral health consultant as part of your primary care team to be able to talk about what's going on. There are also mental health organizations in the community that you can access that really target people who are insured through Apple Health. And they have a robust plan of services that they can offer people, including case management, counseling, psychiatric services, peer support, group support. There is the Crisis Clinic, which is a 24/7 phone line that people can access if you're ever feeling like you're in crisis and you just need to talk to someone or you're concerned about your safety. They are well-trained staff there to support you. There's a 24/7 texting line in case talking on the phone is not your thing, but you still need to reach out to somebody. You can do that on the texting crisis line. And then checking out you can always look at the King County .gov website where you can find additional resources to meet whatever need you're encountering. Neighborcare also offers we have a team of social workers that you can meet with. They work hard to stay on top of financial and housing resources, food and clothing that might be available for people, because we know that people are struggling in so many ways, and we want to help you find the resources that are out there.
So how does somebody get in touch with Neighborcare?
Yeah, if you are already a Neighborcare patient, then you can call up and schedule an appointment with a behavioral health consultant directly just by asking to speak to behavioral health or mental health professional. If you are not a Neighborcare patient yet, but you are interested in becoming one, you can check out our website, neighborcare.org, and see more about the services that we offer. And you can give us a call and schedule an appointment to establish care with one of our medical providers, and then you're off and running.
Thank you so much for your time, Dr. Strauss.
Thanks so much for having me.
Man, you know, one thing Dr. Strauss hit on is like people are stressed out, you know, and whether I mean, a lot of people don't have COVID. Most people don't, but COVID is stressing everybody out, whether you got COVID and you dealing with it, whether COVID got everybody in your house all day long, whether COVID has you away from everybody, whether COVID has you over or underemployed or working too many hours. It's like, man, it's a lot of stress out there.
Yeah, it is. And there was actually a recent study done by Kaiser Health that showed that 53% of adults in the United States actually reported that their mental health has been negatively impacted by the coronavirus. And they broke it down even more and kind of spoke to things like, were you being negatively impacted when it comes to the stay-at-home order? You know, and I think it was something like, let's see. Yeah. So 21% said they had were having a major negative impact to sheltering in place. And 27% said it was a minor, but still substantial negative impact from the shelter in place orders. So it's not just people with COVID.
Man,
so that was actually in July. So can you imagine now where we're at?
I don't know. It's much higher now.
Yeah.
It's much higher now. All right, good stuff. So I know that we're back again on Wednesday at 6:15 p.m. We got a big dog on that show.
Yeah, we do. So we actually have the health executive who's going to be joining us. Dr. Jeff Duchin, Public Health Seattle and King County Health Officer, will be joining us on Wednesday night at 6:15. We'll be talking a little bit about everything, but with a focus lens on King County Health. So talking about vaccine rollout, talking about COVID rate, shelter in place, all those things. We'll be diving in deep with Dr. Duchin next Wednesday.
Maybe Dr. Duchin can also go deep on this when we talk about the disparity there in South King County as well.
Yeah, I hope to ask him some questions about that. It's pretty wild, the disparity that we see, you know, going from Ballard to, you know, where I'm at in Skyway. It's, you know, in some areas twice as much, you know, in the South End than the North End.
That's crazy. All right. Anything else for today, Nikki?
No, you can find this episode in just a few minutes and all our past episodes in podcast format on your favorite podcast streaming platform. Don't forget to hit subscribe or follow when you're there so you can get a notification anytime we post a podcast, not just our coronavirus update, but any of the amazing Converge Media podcasts that we have. You can also find all the past video episodes of this show at whereweconverge.com and just navigate over to the COVID-19 resource page.
All right, fantastic. And we're both back again tomorrow morning at 11 a.m. for the morning update show. And the coronavirus update show is on air again Wednesday, 6:15 with Dr. Duchin. Until then, peace.